doctor is in the house with some tips on how to get nipped and tucked the right way. Welcome back to the Daily Buzz, 23 minutes past the hour. Are you feeling a little fleshy in the waistline? Are you looking to maybe suck a little bit out or maybe get some tucked in? Dr. Scott Greenberg is here to give us the lowdown on the most popular liposuction procedures and tummy tucks. Good morning, Doc.
Morning.
Okay, let's get started. What is the difference between liposuction of the abdomen and a tummy tuck?
Well, basically liposuction deals with only the fat.
Okay.
So if the skin is very, very nice and you think it's going to contract back, we can remove the fat via liposuction. However, if there's extra skin, if there is looseness of the abdominal wall, such as from weight gain or multiple pregnancies, then we really need to do a tummy tuck that removes the excess skin and tightens things up with a series of sutures.
Okay, so who is a good candidate for liposuction and how many areas can be treated at one time?
Well, basically good candidates for liposuction are good candidates for cosmetic surgery. They have a good general medical health. They have, again, only excess fat. The skin's good, the abdominal wall is fine. They're a great candidate for liposuction. In terms of how many areas can you treat at one time, that really just depends on where you are, what state you are. Florida has some pretty strict laws about what you can do in an office. You can pretty much do what you want to do in a hospital, but there are, I think, excesses that we would say are probably not safe in terms of a volume amount rather than number of areas.
Okay, here's the big question. After the liposuction, will the fat ever come back?
Great question. Great question. The point is that when you gain weight, the cells there actually increase in size. You don't gain numbers of cells. So when liposuction is done, the cells are removed.
Okay.
So if you gain a lot of weight after liposuction, there is a chance that the weight could, that fat could come back, but you really have to gain a fair amount of weight for you to see that.
Okay, and who do you think is a good candidate for a tummy tuck? I mean, as far as, you know, you were talking about the excess skin. Is it mostly people who are overweight, obese, lost a lot of weight?
Well, it's people that now we're actually seeing a lot of people who have lost a lot of weight.
Yeah.
But I think a good candidate is somebody who is in good medical condition. They have the criteria that we're looking for, which is that they're not generally obese. They just have a little bit of extra skin, extra fat, and want things tightened up. They're a good candidate for a tummy tuck.
Are there any medical conditions that would prevent somebody from getting either of those procedures?
Yeah, I think if there's severe systemic medical problems such as heart disease, lung disease, etc., there's certain diseases we would want to shy away from. People who have difficulty with healing. Another relative contraindication might be diabetes. The biggest one out there, though, probably for many people, is smoking.
Oh, yeah.
That's going to be a relative contraindication that prevents us from doing large areas of skin removal, such as facelifts, tummy tucks, and a lot of us will ask patients to stop.
All right, Dr. Greenberg, thank you so much. For more information on finding a plastic surgeon or to ask Dr. Greenberg a question about cosmetic surgery or plastic surgery, you can go to our website, dailybuzz.tv.